everyone. Today, I welcome you all to this very first episode of our new talk series, Health Tech Empower Show, presented by HealthPrax, a digital health company. I'm your host, Yojna, for the show today, logging in from Berlin, the startup hub and capital of Germany. So, the question in your mind, what we are going to do on this show? In this series, we will talk about many interesting and time relevant technology topics, mostly related to digital health. Now, when I say digital health, broadly, I'm referring to categories like mobile health, health information technology, wearables, and telemedicine. And why we chose this domain? Because, because this is where the future of healthcare lies. As the show title says, Health Tech Empower. Yes, as we all know, technology in different forms has been empowering and enabling healthcare since decades. And now, with digital health, again, we are witnessing transformational changes. It is removing healthcare access related barriers, empowering patients with better self and preventive care, and bringing efficiency in overall healthcare management. So we are going to talk a lot of related stuff, similar kind of stuff on this show. And I believe that not only the techies and the healthcare providers, but anybody interested in this new digital health domain may find the show interesting. Now, for today's episode in specific, our topic is COVID 19 and digital health, role and roadmap in an Indian healthcare scenario. For this, we have an esteemed, relevant, and diversified panel today. First of all, I'm pleased to invite Dr. D.K. Jham, who is HOD and Director of Cardiology, Paras Hospital, Gurgaon. Dr. Jham is postdoctorate in cardiology from AIIMS Delhi and has practiced clinical and interventional cardiology for more than 30 years now. Dr. Jham, welcome to the show.
Thank you. Thank you, Yojna, for introducing me to the show here.
Thank you so much, sir.
And I thank 10 News and the organizers, as well as Yojna, to include me in this series of talk on digital health and empowerment. And the topic today is on COVID-19 pandemic and digital health. So I will first introduce the topic since I'm the first speaker here. And the term digital health is self-explanatory. But let us see what all it includes. It includes health information and IT technology related to health, digitization of health, and electronic hospital records and medical records and their management in the hospital. And it includes mobile apps that have been used for health and management and digital health, artificial intelligence, machine learning, as well as certain wearable devices. And most important but not the least is telemedicine.
Exactly.
So, telemedicine, for example, which has been launched for the last 2 decades since the year 2001, and ISRO was given the project to launch it in the country in India, has not been able to reach that stage what it has actually done in less than 1 year during this pandemic. Similarly, certain mobile apps, for example, Blue Star, has been US FDA approved, which means that these are definitely useful mobile apps for individuals. And similarly, wearable devices like the Apple Watch that many of us use for personal health monitoring is US FDA approved class 2. Now, class 2 indication for US FDA approval means that there is a definite advantage for it. However, it is not necessary that all of us use it, but there is no disadvantage of using it. Class 1 indication would mean that yes, all of us must use it, and class 3 indication means that it has no definite advantage. So, Apple Watch, for example, has achieved class 2 indication in the US FDA approval list. So, these are all the things that are included in digital health. And let us see how does it give an advantage to us. Digital health gives such a vast majority of data to us that it is very useful for all medical practitioners, doctors, nurses, paramedics, hospital staff, that they can use this vast data for analysis, statistics, and data management to help the hospital do better management as well as for patient welfare and benefit. At the same time, this vast data is also available to individuals who are looking for wellness
Absolutely.
and to patients who are looking for a good medical advice for themselves. As a result, the individuals are able to monitor their own health very well, and they know their heart rate, blood pressure,
Yeah.
pulse, oxygen saturation, blood sugar, and are aware what are the normal levels for these and what next step to take or do so as to maintain themselves in the normal range.
Yeah. Sir,
Similarly,
I will. Can I interrupt you, sir, here?
yes,
Yes. So thank you so much for opening and giving us so much of good, important information. I just wanted to introduce rest of the panelists, and then I have some very specific questions for you. So may I please?
yes, yes, please.
Yes, thank you so much. So I wanted to introduce Dr. Ranjit Singh, who is on our panel today. So Dr. Ranjit is an eminent, highly decorated academician and a futuristic thinker. Currently, he is working as Vice Chancellor of Shobhit University, Gango, Saharanpur, UP. Thank you so much, sir, for joining us today. Then I'm very glad to have an Executive Administrator from Indian Civil Services, Mr. Ashish Phadgai, on the panel today. Ashish ji is currently serving as Chief Development Officer at Pauri Garhwal, Uttarakhand. Formerly, he held positions as a director at Uttarakhand Tourism, additional CEO, Uttarakhand Civil Aviation, CDO Tehri, etc., to name a few. So thank you so much for taking out time today for this discussion. I welcome you on this show.
Thank you.
Then we have Mr. Praful Jain. Mr. Jain is an IT expert on this panel today. He is in IT industry for more than 16 years, having worked with top-notch companies like Intel, Adobe, and finally at Snapdeal in India as Director of Engineering. Currently, he is leading multiple engineering teams at a Berlin-based e-commerce company. Thank you, Mr. Jain, for joining us today.
Yeah, thank you, everyone.
And last but not the least, we have Professor Dr. Siddharth Gupta. Dr. Siddharth is a multi-talented person, and by profession, he's an oral oncologist and maxillofacial imagologist with almost 2 decades of experience in medical and corporate healthcare domain. Thank you, Dr. Siddharth, for joining this show today. Yeah. And a bit about me, I come from pharmaceutical industry, and I'm currently associated with HealthPrax as Chief Executive Officer. So Dr. Jhamp very well opened the session, giving a lot of information. Sorry, sir, to interrupt you, but I just wanted to introduce the rest of the panelists on the show today. And let's continue from there. So Dr. Jhamp, you told about the medical information and medical health technologies, digital health technologies. And you're from AIIMS Delhi, right? And you have been practicing in Delhi NCR for several decades now. So AIIMS at the moment is one of the pioneering and front-running institute when it comes to implementation of digital health technologies. So my very specific question to Dr. Jhamp is that over the years, during your practice at various hospitals, which specific digital health technologies you have seen emerging and being adopted the fastest? You were talking about telemedicine, yeah, EHR, etc. Yes, sir, please.
You're right. In fact, I'll say EHR is the word there, electronic health record management. The aim is to make the hospital paperless now. And we are now sick and tired of sheets and sheets of writing notes in files and maintaining large files, especially if the patient has to stay in the hospital for more than a few days, more than one file and so many pages. But with electronic management, it's so simple. There is just a single iPad at the bedside, and anybody can, with the password, open the iPad and look into all the records, not just related to diagnostics or investigations, but also through certain applications like the PACS, look at various radiological investigations also, including the CT, MRI, angiograms, and the present diagnosis, the present status of the patient. And similarly, the files, the OPDs, the IPDs, everything is now becoming paperless. Amongst the public institutions, you're right, All India Institute has been the first and pioneer to do so. But in the capital today, in Delhi, most private hospitals and all corporate hospitals are turning towards the paperless digitization technique. And I was just telling you regarding all the advantages, and just one or two more lines I need to say there to complete that we have vast data. The doctors and staff has vast data. Patients have vast data about their own cells, and they have more access to things, and they are able to transmit this data from themselves to the concerned practitioners, and there is a good improvement in the quality care because of this.
Okay. Okay. Dr. Cham, do you see any barriers from doctors or healthcare providers and in adoption of technology?
Yes, there have been, I would not use the word barrier, but there has been a little hesitation on the part of medical practitioners. We've been used, for example, I've been practicing medicine now for 38 years. And I've been used to writing prescription in a certain manner on a piece of paper with the pencil.
True.
And note and all that.
Yes,
and
exactly.
now, in the last couple of years, the switch to an electronic mode. But gradually, I'm realizing that this switch is actually for a greater ease for ourselves with just a single
click, yeah. With a
click,
single click,
we'll be able to write the entire name of the medicine. And one doesn't have to worry about the dose. The dose comes automatically over there, unless you want to alter it. And the printer is close by or maybe in the room adjacent, and there is a printout of the prescription. So the hospital is also able to maintain a record, and there can be no dubiosity about it. The patient cannot say that this was not written or that, just in case there is a medical legal complication at a later time. Everybody has a record for everything, and it's really good.
Yeah, out of many advantages, the prescription error rate reduces significantly, isn't it?
Yes.
Yeah.
That is true.
Yeah. So I will move to
inefficiencies reduce, the costs reduce, and there is an improvement in quality care. Yes.
Absolutely. So I will move to Dr. Siddharth, building on the same topic. So Dr. Siddharth, you have worked a lot on COVID-19 relief-related things, and in general, if I say this pandemic actually has shown the mankind and all the healthcare systems in the world that still in this century, how vulnerable we are to infectious diseases. Besides, the pandemic also highlighted the deficiencies in the healthcare systems worldwide, not to mention lack of focus on epidemiological studies. Yeah. But talking about digital health, Dr. Siddharth, do you think that specifically during these times in India, the relevance, usefulness and necessity of digital health technologies have increased manyfold?
Absolutely. I would like to start with since we are talking of the health. So World Health Organization has already said that health is a state of the physical, mental and social well-being in which disease and infirmity are absent. And I would like to add an element of a digital well-being also in this time.
Very good.
Which the disease and the infirmity are really absent. And today is the 5th of December, tributes to the remembrance anniversary of Nelson Mandela, who have also wished to see that at one point of time, we all world globally will be decompartmentalizing ourselves, and all the broken fragments will be removed, and we all will be united into one. And this is the way that digitally we all have been connected like this. And in the times of the challenging times of the pandemic COVID-19, obviously the digital technology, especially in the healthcare, has played a very important pivotal role, because the pandemic, since the time it began, and especially in the time when we are approaching towards the vaccination part, towards the end of the pandemic, COVID part. So most of the thing, either from the acquiring of the information or treating of the patient, the guiding the patients, as well as even to the admittance of the patients, getting the information, the digital technology have played such an important role. I myself belong to the anti-corona task force team as a national healthcare administrator of ACTF. And when the pandemic began, our main purpose was to unify. So what we did, right from Kashmir to Kanyakumari and from Gujarat to Tripura, we united our country digitally. We had the list of all our volunteers, and that too without taking a single penny from the government. We did under the aegis of Akhil Bharatiya Pradhan Sangathan, in which we all had our grassroots workers. And all these grassroots workers were digitally united, unified. In each and every state, we had a representative, a local representative, healthcare representative. Until today, since the information was coming, saving the patient from COVID-19, to the diagnostic, to the testing, to the providing of the plasma also, the plasma therapy. So obviously the digital health, the digital technology has played such an important role. Even when the patient is in any of the hospital, be it a government hospital or be it in a private hospital, it was very, very easier to connect with our doctors, with the health ancillary staff members and the workers over there, and especially the medical superintendents as well, to acquire the current status of the patient. And when exactly is the plasma required, when exactly is the things required, what exactly being deficient, because it's a pandemic which we have never seen in our life. It was the first time since we all have been facing and experiencing and challenging and overcoming these difficult different times. So I think that this is such an important thing which we have tried to manage it successfully. And now when we are on the verge of getting the vaccination done, again, the digital technology is going to play a very important role in the supply chain part, right from the initiation to the deployment of the vaccine and distribution. I'm sure because we have got Ashish ji also with us. My senior Dr. Dhananjay Sahab is with us from All India Institute of Medical Sciences. We have got the expertise from Praful Jain ji also. So obviously it is going to very, very play important role, so that जो हमारी सरकार है, जो हमारे देश के माननीय प्रधानमंत्री जी के सरकार प्रतिबद्ध है हर एक को वैक्सीन पहुंचाने के लिए. So obviously the digital technology is going to play such a very imperative role in this.
I really admire all the efforts that you have put in this whole this thing, so far, Dr. Siddharth. Congratulations for that. But still, it is a very small subset of people, right? In general, in India at the moment, we have digital health technologies here and there, and private and public players both playing their own roles. But I hope all of you will agree that this is very much fragmented at the moment. Yeah. So from that perspective, what do you think out of the array of digital technologies? Because digital health is an ecosystem. It's umbrella term, right? So in this, several technologies fall in place. So out of all these, what do you think, Dr. Siddharth, is the most important and basic when we talk about India in specifically
everything,
the country?
Everything. Likewise, Dr. Jaham has already said, we have got right from the patient walks into our OPD. So we have got the EHR, electronic health records with us, compilation of the data, compilation of the demographic details of the patient, then from to the chief complaint, to the presenting history, then to the past history, the past medical, the surgical history. And then currently, when the patient is completed with the history part, to the examination part, with all the things, be it head and neck examination or the examination of the abdomen or any of the part
so
where the patient is having the
You're talking about the demographic information as well as the health records.
Everything.
So it all falls
because this is very important.
Electronic
अगर हम conventional की भी बात करते थे, because we have got such a senior doctor with us, जैसे फॉर एग्जांपल अगर हम किसी पर्टिकुलर जगह की बात करें, if I spoke of some eastern UP, eastern Uttar Pradesh और वो, I am basically I am a trained dentist, oral medicine expert. हम पता लगा लिया करते थे if a patient is having some yellowish discoloration on the tooth, obviously the next question is that क्या आप नल का पानी पिया करते थे, हैंडपंप का पानी पीते थे, where we used to correlate with the like levels of the fluoride in that.
Yep.
And this is a very, very important. And now with the digital thing so much and with the geographic data, which is already being unifying in such an excellent way, we can really map it out. जो हमने COVID-19 में भी जो map out करा, where are the zones, where the containment zones, where the non-containment zones. So similarly, this has really helped us a lot.
Yeah.
And
Okay.
especially Dr. Jhamb also spoke about the radiology part, imagology part. I'm a trained imagologist as well, be it about the CT scan reports, the MRI, in which we have been working very diligently onto the patient and advanced specialized investigations or the conventional investigations. So obviously these are going to very, very important. The lacuna, yes, I do agree. It could be at the some rural areas or the some semi-urban areas. But in the urban areas, metropolitan cities is not a challenge. It's not an obstacle. And when we are believing in a digital India, which is being ushered into our country, not only from this present government, even from the government stalwarts like Rajiv Gandhi ji until today, Modi ji, which is leading a digital India's health mission. So obviously, I'm sure this is going to bridge a huge gap in the lacuna in our system.
Yeah. Great. Thank you so much, Dr. Siddharth. Moving on to our technology expert, Mr. Jain. So, what do you think from a technology perspective? Dr. Siddharth spoke about EHR and its importance and the usefulness. Do you think that recording all this health data of the patients centrally or at one place, is this the basic minimum digital health technology India needs to adopt today?
Thanks, Yojana, for this question. And I totally agree with Dr. Jhamb and Dr. Siddharth, what they told till now. So like Dr. Jhamb said, some sort of EHR is already implemented in all the big hospitals in India. Even though these systems are right now primarily used for billing and for internal patient record management and not sharing this EHR data across,
it's not across
different
hospitals
right now.
Yes.
And, yes, so that's one thing which is lacking. The other thing which is quite important to understand is EHR is the building block. So unless you have data for the patient, you cannot build any other advanced technology on top of it. So we need to try and push for EHR, not just in bigger hospital, but even in smaller hospitals and smaller clinics, which are across the rural India.
And here I will,
one thing
sorry to interrupt you. I would like to just quote a recent Economic Times report that read, India bullish on artificial intelligence in healthcare without electronic health records. Yeah. And you're saying the same thing.
Yeah, totally agree. Is to try and use any new technology, whether it is artificial intelligence or Internet of Things, we need to have data present first of all, and EHR is the basic minimum required so that we have all the patient data stored somewhere, and then we can use all this data and run algorithms and use scientific technology to streamline all these things. And to achieve this, I guess it needs a combined push, not just from government, but private player combined together should work in this common objective.
Okay. Great. Let me move to Ashish ji here. So, a market analysis report by Sheetal Ranganathan titled Towards a Holistic Digital Health Ecosystem in India. I quote here, without the digitization of health infrastructure and delivery, India cannot accomplish its growth potential, as duly acknowledged by the Government of India. So as per my awareness, there has been significant work done in Uttarakhand in the area of telemedicine in specific. So would you like to throw some light on that, please?
Good evening, everyone. Today we are talking about digital health. So first, I will tell that digital health incorporates telemedicine, robot-assisted surgeries, self-monitoring healthcare devices, EHR, mobile health, big data in healthcare, health service aggregations, targeted advertising, e-pharmacies, e-learnings, etc. And I have a survey also, a patient survey. Recently, they had a patient survey, and it predicts that 75% of all patients expected to use digital services in the next coming 5 years. So this shows the importance of digital health in India. And when we talk about Uttarakhand, so in Uttarakhand, recently our Honorable Chief Minister has launched an e-hospital and telemedicine facility in Dehradun at Doon Medical College, Uttarakhand. And these facilities would help to reduce congestion at hospitals, as everybody knows, and which could further reduce the risk against the COVID-19 pandemic. And these facilities would also be a perfect tool in providing medical assistance in remote areas where it is very much difficult for medical help to reach. And recently in Uttarakhand, there are two places. One is Betal Ghat, that is in Nainital district, and another one is in Champawat district. So in these two areas, we have already started a telemedicine service over there. So it is running quite well there. And in this initiative, a private player named Care Expert Technologies have signed a MOU with the state government. So they are providing us the technical know-hows and inputs. And this solution comes with integrated patient EMR, EHR, cloud connected medical IoT devices, for machine-to-machine real-time information sharing with the remote doctors, and is enabled with e-prescription for the doctor to send the prescription in the same session. So this service is running quite well in district Nainital and in district Champawat, and people are also getting very much benefited with this service. Earlier also I was posted in the district area as CDO. So in district area also we have started Hello Doctor 555 service. So it was a small effort at that time, but people liked it very much, and I was there for 1.5 years. And in this period, more than 3,000 people have used this service. So people was very much satisfied with the service because, like in hills, as you know, we have a very vast area. Uttarakhand has a very vast area which comprises around 54,000 square kilometer, and it's a very remote and hilly terrain. So medical facilities are very much they are not easy to avail, and we don't have doctors also because we have very remote areas. So doctors also quit their job. So it's a problem in hilly and rural area. So this can be a boon to our farmers and our rural population, digital health.
That's really encouraging, a very important information, because and this is what I wanted to learn from you, because you are posted in these areas, and we wanted to get the perspective from the rural side and the hilly side of India. As Dr. Jham mentioned, in the urban area, we are talking about Gurgaon, Delhi, NCR. There is already a good penetration, and both at public sector and private sector. I won't say, I mean, as per the statistics, it looks like we are just getting started. There is so much more to do. Yeah. Similarly, what you mentioned, Ashish ji, in Champawat and Nainital district, the numbers that you mentioned, it looks like pilot projects, yeah, successful pilot projects. Would you agree?
Yes. It was a pilot project, yeah.
Yeah. So how do you see, and how, within what tentative time frame do you see this getting scaled up to masses? Uttarakhand is a small state in itself, right? And we are talking about pan-India digitization. So do you think, what time frame, reasonable time frame do you think, and what is the determination of the government to fund and work towards digitization of healthcare services?
The government is totally determined to flourish this project, and in other districts also, like in Pithoragarh, in Chamoli, and even in Pauri, we are starting and working on this telemedicine facility. So I think in next coming 5 years, we will be in a better position.
Okay, good to hear that. Yeah. Wonderful. Thank you so much. I will move to Dr. Ranjit. So, as an academician, I think there is some echo and background noise from your side. As an academician, where do you see the role of academia in overall digital health ecosystem? Because as a guest speaker, I have visited many universities and I saw that there was increasing focus on seminars on mobile health, digital health, etc. So do you think it indicates some kind of trend? And as a policy, and you are a policy and
Yeah, and
performance influencer as well. So what regulatory decisions do you think government should be taking to facilitate growth of digital health ecosystem in India?
thank you, Yojana. And I am quite enriched by the discussion by the experts. But before I answer to your queries,
Yes,
I would like to mention two incidents here. It is my experience basically when we speak of digital health in India. Recently, I visited a very big hospital. I will not name that for my wife. And the first experience when it comes to COVID. So, as a matter of practice, they ask you to for the COVID whether you have some symptom of cough, cold, or etc. But they were simply doing that on that performa. They were not asking anything from the patient or the attendant. They were simply drawing a line on that and handing it over. So what I want to say here is that we have to be very honest and sincere in the efforts. That is the first thing what we need here in India, in my country, because sometimes we just generate data for sake of generating data. Second incident of digital health, that is big hospital, and all the reports of the patient, they are uploaded on the computer and they are accessible to all the doctors. So one of the doctors there asked me to get a bunch of reports photostated. I told her that they are available on the computer, but she said, no, they are not available. So I went there, I got photostat over 50 to 60 pages. So that is the experience. And now I come to the question. Yes, academia has to play a very important role in fostering the growth of this overall digital health ecosystem in India, and especially in generating the skilled manpower, which we are lacking, that manpower, and to provide necessary infrastructure that we are also lacking. Though there are many positive things, I am a very optimistic person, but still we have to see these negative points and we have to move forward. And the main role that academia can play is to raise awareness among the users, providers as well users. That is the necessity of the hour. And as you told that there is an increase in the webinars on digital health and all that, it is a very good indication. That means we are getting aware of the idea, and once we are respecting the idea and we are registering it, it means we are moving to the right direction. So digital health definitely will play a very important role. What we need is to be very honest and sincere in our efforts.
Sir, so as Vice Chancellor of a university, if I talk about very specific steps, what do you plan to do so that your university gets equipped the manpower that we need for the future generation, for the advancement of this technology in India? We are generating that skilled manpower through the institutions. Any specific things you would like to implement in your university?
Yeah. Right now, within the framework of rules and regulations, we are doing our best. And being a private university, we are open to experimentation, and we do that. We are open to, start such courses which are required, and we have that autonomy. And what I see in this national education policy, which is being implemented, all these things are very much emphasized, and much of the autonomy will be given to the academic institutions, and that will certainly give us upper hand in starting new courses, in starting courses which are really useful.
Wonderful. Okay, great. That's good to learn from the Vice Chancellor of Shobit University. And we have been talking a lot about technology, digital health technology. Let us hear from our technology expert, Mr. Jain. In layman words, what do we mean by digital health technology? We hear the buzzwords: artificial intelligence, blockchain, Internet of Medical Things, and many more. Yeah, every day there is new buzzword coming up in this arena. So can you just, as I said, in layman, very briefly explain or give an overview of these technologies to us and our audience, please?
Yeah, sure. So some of the technologies we already know and we heard from all the experts in this panel, like electronic health record, where we store all the patient data, or nowadays in India, we have a lot of appointment booking apps where you can just go and block appointment for a patient for clinics. You have digital prescriptions which are available. You have apps where you can just go and use and check for your symptoms on the mobile app itself. We have all the CT scan, MRI reports, and all the lab reporting online. So these are some of the things which are already there. I'll try and touch upon some of the technologies which are emerging technologies. One of them is telemedical consultation. So in this case, we use our mobile phones, smartphones, laptops to connect to the patient and the doctors, and it's a quite quick and it's a non-urgent consultation where you don't need to really visit the doctor because you can just easily get all the consultation over the phone itself. And this can save a lot of time because you don't need to travel. You can skip all the face-to-face appointment, and especially in this corona COVID situation, this is quite helpful. This is one technology. The other thing which is quite emerging technology is Internet of Things, like Internet of Medical Things, where there are a lot of smart devices available in market. So let me just try and explain what Internet of Medical Thing is, and then we can go a bit deeper into it. So Internet of Medical Thing is more about creating an infrastructure where you have set of collections of medical devices and software applications which are connected to each other, and they can share data between these things. And it is also known as healthcare Internet of Things. The main thing here is smart devices which have a lot of sensors in them, and using these sensors they monitor the patient health in a continuous manner and then send this data to the doctor or to the hospital. Now when we say sensors, there are a lot of sensors available, or the devices available, like accelerometer, temperature sensor, CO2 sensor, blood oxygen sensor, ECG, gyroscope, blood pressure, respiratory sensor. So a lot of devices are available in market right now. The next phase is to connect these devices so that when you are wearing these devices, they automatically send data and store it in a digital way, either in the clinic or send it to the doctor. And what it will do is it will allow these doctors to diagnose the disease and give all kind of alerts beforehand, so that if there is any kind of eventuality happen before that, there can be some alerts raised automatically. So these are some of the things which are already being done in many of the developed countries already.
Okay.
And by
and how does artificial intelligence, because artificial intelligence is something which has its implementation potential in almost every domain at the moment you can think of. So in healthcare, exactly what it does, how it can be used to do what, to how it impacts patients' life at the end and improve healthcare delivery, or improvement in efficiency improvement in healthcare systems.
So artificial intelligence is a quite broad term. What it means is using computer algorithm to generate some conclusions based on input data. Now, in case of medical domain, we have a lot of data coming in when we talk about these sensors or the records or the historical data from the patient. We can use all these data and run some algorithms which can generate different conclusions out of it. And this is where this AI technology is different. It is the ability to gather this data, process it, give a well-defined output. And through the use of deep learning and machine learning algorithm, we can generate useful insight and predictions and get all these things out quite remarkably.
Okay, wonderful. Thank you so much. I hope it improved our knowledge on this topic, because definitely this is a very, very broad and very vast topic, and we need a lot of discussions to understand the details of it. But the purpose of this episode is just to open the discussion and get an overview of what digital health technologies mean in Indian scenario, and why it has become so much important during the COVID times in specific. Yeah. So we established till now, we established the need of digital health in India. We talked about what is the current status. Let me open the next few minutes a quick round of discussion on the roadmap ahead. Okay, so I will go to Dr. Jham, and a very specific question, sir. You said that yes, in urban India, especially North India, the Delhi NCR area we are talking about, most of the private hospitals have been digitized. I'm not sure if what is the percentage of this digitization, and what is the accuracy level and the quality of this digitization at the moment. So would you like to comment on that, the percentage and the quality, as Ranjit sir also commented on the quality part a bit? How far we have to go? Where are we at the moment? That's what I want to understand.
That's a very important question, and it's very interesting. Now, see, the roadmap ahead has already been outlined by the country, and there is a national digital health blueprint, which was written down, the first of its series, in January this year. And while it was still being implemented, I feel that now, since the corona or the COVID-19 pandemic, there will be an acceleration in its implementation. What we could not achieve in telemedicine for last 20 years since its launch and its push by ISRO in the year 2000 onwards, we have been able to achieve in less than a year in telemedicine in this year because of the COVID pandemic. Similarly, whatever the country envisages to push itself ahead in artificial intelligence, in telemedicine, in digitization, it will be able to do it very rapidly now. Now, for doing this, what it has thought of is making an edge cloud, a health cloud, which will be a data hub for all health and medical related information. And it will try and digitize each peripheral center. There are thousands of PHCs, peripheral health centers.
Yeah.
And Mr. Ashish will agree that each block has multiple of these depending on the population that it caters to. And it should be the duty of the block development officer there to look into three things in that particular primary health center. One, that there is an internet connectivity there, that there is a connection there rather than make and break connection. Number two, we need to have at least one or two laptops or PCs or any other mobile apparatuses there to connect things there. In other words, it should be equipped well enough. And third, there should be skilled staff there. So if the government is able to provide these in each of its PHCs with the help of BDOs over there, I'm sure very soon the connectivity will extend to the entire country. At the present time, this is mainly restricted to the metropolitan towns and Gurgaon NCR. If you ask for the penetration in terms of digitization, would be about 60 to 70%. But as one moves to the periphery, it may even fall down to 10, 15% or even less. So that is very important there. That, and you know, as Mr. Jain was talking about telemedicine has now gone to such a great extent that recently I visited a center which was using telemedicine, and I was astonished. They have a stethoscope there, they have an otoscope, they have an ophthalmoscope, a gyroscope. So all of these scopes tell about whatever they are actually meant for. A stethoscope is meant to be kept over the chest. It will talk about heart sounds, lung sounds. The otoscope over the ear, they have ophthalmoscope to look into the eye, and all that the individual at the periphery has to do is to turn the light on, put it on that particular part of the body of the patient, connect it to the telemedicine PC terminal there, and the sound or the ECG would be directly transmitted to the doctor at the other end. What else does one need?
Yeah, absolutely.
If there is a camera which shows the patient, his condition, The doctor is able to see whether the patient is in a good condition, whether he has pallor or he's breathless, is he in pain, he's in agony, or he's able to listen to his heart sounds, is sitting in the periphery, listen to his breath sounds, look into his eyes. What else? One can even perform an ultrasound examination, a chest X-ray, and transmit it within a few seconds from one end to the other. And I'm sure the doctor at the center and the one at the periphery can confirm to a good diagnosis together and let the patient have the best of the things there, except for robotic surgeries or for procedures, the patient may have to come, but otherwise things can be done there. The government has a good plan there, but we must get into the initiative phase for all this. And that is why I think it's very important you've included in a civil servant also. And it is a duty of them to see how together they and us can take these to the periphery.
Exactly. So you clearly, very nicely, demarcated that how the private and the public sector need to play their roles here. Yes, technology can do a lot, but then the infrastructure readiness, the technology readiness and the resource readiness of the area is very, very important. And that's what we need to ensure. So, Dr. Siddharth, how do you see the role of private players in this whole domain? Like, I will talk about HealthPrex. We are part of this digital healthcare ecosystem, and this is very encouraging for me as a leader of the organization to hear from Dr. Jham, a senior doctor, because when we read the reports, one of the biggest barriers that we come across in India is the barrier from doctors' end in adoption of technology. But to get such positive, feedback and information from Dr. Jham is really very encouraging, and this is something which will really help fostering digital health technology overall, growth in India. So, what do you think about role of private players in this domain, Dr. Siddharth?
I feel it's going to be very important, very imperative, because private players, still we've got a lot of scope in terms of implementation, in terms of improvement also. Mm-hmm. Secondly, when we were hearing about the telemedicine, the other specialties, teledentistry, telesurgeries, teleradiology, teleimagology, and now we have got a tele-COVID-19 treatment as well, which is also going on. Fortunately, sitting over here in Delhi NCR and treating my COVID patients who are in Florida and successfully treating them as well. So there's a lot of scope and a lot of improvement, and we have no competition at any level with anyone. Mm-hmm. Because I think it's because there's so much of scope, like in the way in IT, because Prafulji is there, we have managing information technology through transitions in various organizations, be it in the form of ophthalmology, orthopedics, cardiac, or even emergency care and all that. Or we are trying to diversify things, picking up the things, and bringing to convergence. What we call is the centripetation of the centrifugal actions, basically. Because the motto is to ensure everyone is achieving a proper good health at the end of the day. So when we are focused, I'm sure it will be only achieved and only be possible if we have the private players, and I'm sure that we'll be getting a good support as well. Because there's so much to ponder upon. India, obviously, is a cradle of civilization. Such an ancient history right from the days of Charak Samhita and the Sushruta, who have really taught surgeries to the outside, so many Western world and all that. Until today, I'm sure it's going to be a huge success because, as I'm saying, that we have no competition, but more of the cooperation.
Yeah, absolutely. Yes. There's so much to do. Yes. So rather than competing, it's more about collaborating and making it happen. I completely agree. And to Ashish ji, my question would be, yes, government is doing a lot and they have a blueprint in place and they're working towards it. As an administrator, if I ask you that, if you have to give one recommendation so that the whole process can be accelerated, okay, what that recommendation, a regulatory or process reform recommendation, it would be to improve, digital health ecosystem in India, especially in the rural areas, in hilly areas, for example, because ultimately what we want is that we can use and leverage technology to deliver better, care to our patients. That's the ultimate vision, the goal that we all should have in our mind. So, what do you think?
See, first we have to strengthen our infrastructure. Like we see in rural areas, like Dr. Jam was telling, we don't have proper computers, we don't have proper connectivity. So we have to improve our infrastructure as well. Plus, government is also doing some legislative interventions like Disha and PDP. Disha is Digital Information Security in Healthcare Act, and PDP is Personal Data Protection Act. These are underway. These two acts are underway. So these are some legislative interventions also, which need to be done, which are need to be done by the government. So government is also doing their part. But as we plan in rural area, in hilly areas, so infrastructure is the main thing. We have to improve our infrastructure. Like we see, this is a general practice in hilly area. Doctors don't want to stay there. When we recruit fresh doctors, so automatically after 1 year or after 2 years, they automatically quit this government job and join some metropolitan area or somewhere else. But they quit. Generally, this is the practice. So government at government level also, it's a topmost problem. Yeah, because we every year we recruit fresh doctors, but due to poor infrastructure, they don't want to stay there. So, but government is working on this, and we have opening recently. We have opened some CSC, some PSC, which are very well maintained, and there we have provided broadband facility as well. So, over the period of time, facilities are increasing also. So I hope in next coming years, facilities would be better.
Hopefully, yes. Thank you so much. Yeah.
Plus, like in Uttarakhand, we have opened some medical colleges as well, like in Srinagar, like in Pauri district. So we are taking bonds also from fresh graduates. So now they are working in hills. So
there can be some mixed models to retain the resources, which can provide them more flexibility to move around and still be available to consult the patients remotely or something like that. I mean, we can think of some innovative models. I'm just thinking
these type of interventions can be done. Yeah,
exactly. Yeah. Okay, Dr. Ranjit, any additions from your end? What can be done from academia perspective? Regulatory changes, recommendations.
See, from academia side, we are doing what we can do. What Ashish ji just told, that to enhance the infrastructure, and I will only add that we have to enhance the skills of the seeker and the provider. That is two things. Yeah, that I want to add.
Wonderful. Great. So I think this was a very, very good, productive, enlightening panel discussion. But we definitely need lot of more such discussions to move ahead on this path and bring India in league with other countries for optimal utilization of digital health technologies for, of course, with a common vision in mind for the betterment of healthcare in India. Yeah. So in summary, I would say the essence is that when today almost everyone in India has a smartphone and internet access, as a country, why can't we leverage this changing dynamics to improve the healthcare delivery to patients? Especially, I would quote to the most vulnerable and remote population like Pauri Garhwal, right? So many thanks to my eminent expert panelists for their valuable, insightful views and opinion on this topic. Any final comments from anybody's side is most welcome before we close the show today.
I have something to say.
Yes, sir. Please.
I think the government should try and make a regulatory body there, just like as TRAI or RERA or EDAI. So similarly, there has to be a regulatory body made now. And there should be a compliance to the Director General Drug Controller of India. Because whatever we do now related to telemedicine, or mobile apps, or any other digitization process, we have to ensure that there is a cyber security there. Things are safe both to the patient, to the provider, as well as to the seeker. And
Absolutely.
the seeker most often is not necessarily a patient. He may be just a healthy individual looking for further wellness. So we have to ensure the safety of them, a regulatory body, and we have to encourage free, meaningful, useful applications, mobile applications to come forward with, which people can use rather than ones just for purposes of, let's say, some commercial benefit or the other. For example, I'll just give you a small example. Pacemakers that we use for permanent pacemakers for heart blocks, which we implant over the chest wall over here. And we've been doing this now for about 35 or maybe even 40 years. But in the last 5 years, pacemakers have an inbuilt Bluetooth device. And with that, and a small application downloaded to the mobile phone of the patient, he can now record all the data from this pacemaker using Bluetooth and transmit it to the central place from where it is further transmitted to the concerned doctor. As a result, this patient now never has to go to the hospital for a pacemaker check. He may be in any remote area wherever there is a mobile connectivity. And with that, whether the pacemaker is working well, whether the pacemaker battery is coming to an end of life, whether he is having any arrhythmias, any blocks, or any other event can be easily conveyed to the physician, who can simply by a mobile telephone again transmit whatever his view or opinion is on that. So we have to ensure these safety measures encourage useful things and have a regulatory body.
Very well said, sir. Thank you so much for summarizing it so well. I'm thankful to all of you for such valuable insights, and to all the viewers for watching this show today. Feel free to mail me at yojna.jan@gmail.com to ask any further questions on this topic. Under this forum, on this platform, we will be bringing more such discussions, more information related to digital health in India, in emerging markets, worldwide, what is happening, and much more. Okay, so stay healthy, stay safe. Thank you so much. Namaste, namaskar. Have a nice